Good afternoon, everyone. Thank you for joining us. I've got quite a substantive update for you today, so please bear with me. And as you can see, I'm joined by Humza Yousaf, our new Health Secretary, and also by Jason Leitch, who will help me answer questions shortly. Firstly, though, I will give you an assessment of the national picture in relation to the pandemic, and I will also set out and explain the decisions the Scottish Government has reached today in relation to Moray and the city of Glasgow, and also East Renfrewshire, which has been subject to particularly close examination in recent days. But firstly, I will set out today's figures. The total number of positive cases reported yesterday was 414. 212 of these were in the Greater Glasgow and Clyde area, 62 in Lanarkshire and 48 in Lothian. The total number represents 1.9% of the total number of tests, and it means that the overall number of confirmed cases is now 231,282. Currently, 81 people are in hospital, 2 fewer than yesterday, and 4 people are in intensive care, 1 down from yesterday, and no deaths have been reported in the past 24 hours, which means that the total number of deaths under this daily definition remains at 7,664. But of course, I want, as always, to convey my condolences to everyone who has lost someone as a result of COVID. Let me touch quickly now on progress in the vaccination programme. As of this morning, 3,082,251 people across the country have received a first dose of the vaccine, and that's an increase of 18,603 since yesterday. In addition, 26,968 people got a second dose yesterday, and that brings the total number of second doses now to 1,769,040. Now, today's figures show that across much of the country, cases remain at relatively low levels, and that is positive. And also the number of people in intensive care and hospital with COVID continues to be lower than it has been for the majority of this year. That said, there are no grounds at all right now for complacency. We are seeing an increase in COVID rates just now, not just in Glasgow, although the biggest concentration is in Glasgow, but we're seeing an increase in several parts of the country. Across Scotland as a whole, new cases have risen over the course of the past week by more than 25%. And the latest estimate we have of the R number suggests that it now might be slightly above 1 again. And although the vaccination programme is proceeding well, and it is proceeding exceptionally well, and that means, and I want to stress this point, that we should still be really optimistic about the future because of how well the vaccination programme is going. But at this stage, and this is something we also have to remember, at this stage, less than half of the adult population has had both of the vaccine doses, and there are many younger people who've not yet had their first dose of the vaccine. So while we are still extending the coverage of vaccination further, and we are doing that as quickly as supplies allow, it is still really important to be cautious. And that is particularly so in light of the impact of the so-called Indian variant of the virus, which from now on I'm going to refer to as the April 02 variant. Now, in recent weeks, this variant has become quite established in many parts of the UK, including here in Scotland, and we have reason to believe that it might be more transmissible even than the Kent variant, which spread so rapidly, you will recall, over the winter period. Now, in recent days, the Health Secretary and I have been discussing the current position in some depth, as you would expect, with our clinical advisors. And we have been paying particular attention to the situation in Moray and in the city of Glasgow. These are the only 2 parts of Scotland which right now are currently in level 3 of our levels of protection. But we've also been paying some close attention to East Renfrewshire, which has in the past few days also seen a steep rise in cases. And I want to talk about each of these 3 areas in turn. And before I do so, and I'll return to this point later on, we look, of course, at the headline figures, at the raw figures. But as we make decisions, we also look in detail at what underlies these raw figures, because sometimes, because of the different size of areas, the raw figures can mask a much more complex situation. So I'd ask you to bear that in mind. But if I can turn to Moray first of all, I'm very pleased to say that the situation in Moray has actually improved very significantly. Last week, the area was reporting 98 new cases a week per 100,000 of its population. That's now fallen to 37. Test positivity has also fallen quite markedly from 2.8% a week ago to 1.3% now. In addition, and this point is quite important, the April 02 variant does not seem to be as commonly present in Moray as it is in Glasgow and indeed in some other parts of the country. So I'm able to confirm today that Moray will now move down from level 3 to level 2, and this decision will take effect from midnight tonight. This, I know, will be welcome news for people and businesses in Moray. For very good reasons, they've had to wait longer to go into level 2. And this progress has been made possible by the efforts of local public health teams, their partners, and of course the public. And I'm grateful to everyone who has played their part. I would say, though, that it's important to continue to be careful. Being in level 2 still comes with necessary restrictions, so please stick to those as you have stuck so well to level 3 rules, and do everything you can to help Moray and indeed the country as a whole enjoy more freedoms and more easing of restrictions later in the summer. Let me turn now to the situation in Glasgow. Over the past 10 days, there have been extensive public health measures deployed across the city. These include enhanced testing and vaccination in the areas with the highest rates of COVID, especially in the G41 and G42 postcode areas, areas I know very well myself because they make up the bulk of my own Glasgow Southside constituency. Enhanced contact tracing has also been put in place. This is also being used in Lanarkshire and Fife right now and will be adopted as necessary in other areas when we're dealing with rising cases or new variants of concern. The enhanced tracing means that teams may well ask close contacts of close contacts to self-isolate and book a test. And that's a really important way of trying to break possible chains of transmission as quickly as possible. So if you are a contact of a contact and you are asked to self-isolate and get tested, it's really important that you follow that advice. And it's really important that you follow that advice even if you have been vaccinated. Now, despite all of the efforts that have been made in the past 10 days, though cases are still rising in Glasgow, and we are fairly certain that the increase is being driven by the April 02 variant. Last week, just to give you some context, we were seeing 71 new cases for every 100,000 of the population. That's now risen as of this moment in time to 112. Now, that increase will partly be due to the fact that there is more testing being done, but the percentage of positive tests has also increased over the past week from 3.1% to 4%. So in summary, we don't think that we have turned the corner in Glasgow yet. Let me stress, though, that we are confident the major public health interventions underway will be effective and that they will bring rates of the virus back under control. But our judgment is that they need a bit longer to do that. We also think we need a bit more time to be more confident than we are just now that vaccination will stop the rising case numbers today becoming sharply rising hospital and severe illness numbers a couple of weeks from now. So for all these reasons, I can confirm today, regrettably, that Glasgow will remain in level 3 for a further week at this stage. I know, not least because I live in Glasgow myself, how unwelcome this is for individuals and businesses, but I genuinely hope it will not be for too much longer. And of course, all of us who do live in Glasgow can play our part in getting this under control as soon as possible. Every single one of us who gets tested, every one of us who gets vaccinated when we're invited to do so, and every one of us who sticks to the public health guidance is helping get things back on the right track. So please continue to do that. It is really important. Now, the final area I want to talk about today is East Renfrewshire, and this is where I'm going to go into a bit more detail about the differences between East Renfrewshire and Glasgow, notwithstanding the apparent similarities. Because on the face of it, levels in East Renfrewshire as a proportion of the population are actually very slightly higher than in Glasgow. In the last week, we've seen 118 new cases for every 100,000 people. I'm acutely aware, therefore, that people will look at the raw data and say, if Glasgow is in level 3, East Renfrewshire should be there too. But as you have heard me say many times before over the past year, and I know this is really difficult, but it's important, the situation underneath the raw data is often more complex, and it's the detailed analysis that we must try to base decisions on. For example, while the case rates per 100,000 in Glasgow and East Renfrewshire look similar, the total number of cases in East Renfrewshire, because it's a smaller area, obviously, is significantly smaller than in Glasgow. So to illustrate that, yesterday there were actually just 17 new cases reported in East Renfrewshire compared to 166 in Glasgow. And more importantly, many more of the cases that have been reported in the last week in East Renfrewshire can be traced to specific household clusters than is the case in Glasgow, where transmission appears to be much more widespread. So that means that we think strong and targeted public health measures have more of a chance at this stage of stemming the rise without the need to use wider restrictions. So taking all of that into account, our judgment, and these decisions are often finely balanced, but our judgment at the moment is that East Renfrewshire should stay at level 2 for now, although this will be kept under close review, and we'll continue to use enhanced public health measures to try to keep COVID rates under control. But I want to stress again, as I've done to people in Glasgow and Murray, to those who live in East Renfrewshire, that it's really important that you cooperate with these enhanced measures. Get tested, even if you don't have symptoms, get the vaccine when it's offered to you, and be very careful when meeting other people, especially indoors. And although we are not putting travel restrictions in place for East Renfrewshire right now, please think about whether you need to travel over the coming week. If you were planning to meet up with friends in another part of the country, perhaps think about delaying that for a week or two. By doing that, all of you can play your part in reducing case rates and hopefully in ensuring that East Renfrewshire can stay in level 2 and then, of course, move on to level 1 with hopefully the rest of the country in the coming weeks. So I've taken a bit of time to go through the decisions in each of these 3 areas because they are complex decisions. We are taking consistent decisions, even if sometimes it perhaps might not look at that, because we are looking at the very detailed picture in each area and trying to be as proportionate as we possibly can be. Now, I've got one other measure that I want to set out today, which relates to travel within the United Kingdom. At the moment, anyone in a level 1 or level 2 area, and of course that is most of Scotland, can travel to any other level 1 or level 2 area within Scotland and to any other part of the UK. However, we know that there are particularly serious outbreaks of the April 02 variant in 3 specific English local authority areas, Bedford, Bolton and Blackburn and Darwen. So for that reason, from Monday onwards, we are imposing, hopefully temporary, travel restrictions on travel between Scotland and those 3 local authority areas in England. So if you were planning to visit friends or relatives or to stay in those areas, Bedford, Bolton and Blackburn and Darwen, you must delay your visit. We're not placing legal restrictions on travel to Lancashire or Greater Manchester more widely or to areas around Bedfordshire. But if you're planning to visit these areas in the next few days, please consider whether you need to make your visit or whether it can be delayed. And finally, remember that the situation with this new variant changes quickly. So if you are travelling to somewhere else in the UK, look and see what the situation at your point of destination is. At the moment, we would advise against travel to any part of the UK where there is an active health protection response associated with the April 02 variant. Now, we hope that these rules and guidelines will not be in place for very long, but at the moment, they are a further way of helping us reduce the risk that any more of this new variant comes into Scotland while we are trying to deal with outbreaks of it that we have right now. Now, I've got 2 brief final points that I want to make before I finally finish and go on to questions today. The first is about tomorrow's Cup final. This Tomorrow will, of course, be a big day for both St Johnstone and Hibs fans, and I know that fans and indeed others will be wanting to watch the game. However, please don't gather in big groups in people's houses or in hospitality venues to watch the game. That is still against public health rules and is not safe in the current situation we face. And for supporters of the winning team in particular, and may the best team win, but for the winning team in particular, remember that no one, including fans, should be congregating anywhere in large numbers at the moment. So please enjoy the game, celebrate if your team wins, but for your own sake and for the safety of others, please do so safely. And that is something that I urge on every football fan watching the game tomorrow. Now, the final point I want to make before ending is really just about the overall course of this pandemic. Ever since we got the first news of the successful Pfizer and then AstraZeneca vaccine trials last autumn, we have believed that vaccination would provide us with a route out of this pandemic. And I want to stress today that that is still the case. I still firmly believe that. In fact, if anything, the performance of vaccines so far in real-world conditions, not just in clinical trials, has been remarkable and actually better than we could have dared hope back at the end of last year. But we also knew, and we still know, that the route out of the pandemic is never going to be completely straightforward, and unfortunately will probably not be completely linear in every respect. We've always known that there would be bumps in the road, and what we're experiencing now is one of those bumps in the road. The presence of the April 02 variant in some communities is undoubtedly a setback. We know, or at least we're fairly certain, that it is more transmissible than the Kent variant we had previously been dealing with. But the upside, and I want to stress this as well, at the moment we don't see any signs that it causes more severe illness than other variants, and we believe that the vaccines still work against it. It's not possible to be definite on these issues yet. It's still very early days, but we should all continue to hope and indeed expect that over the summer we will be able to progress through our levels of protection and back to a much greater degree of normality. Over the next 3 weeks, we intend to publish more detailed work on our expectations for life beyond level 0 as we return, hopefully, to something that we all recognise is much closer to normal than even level 0 restrictions. The April 02 variant undoubtedly gives us many more reasons to be very careful. But we also, and I don't want us to lose this point, we also still have really good and really strong grounds for optimism. All of us have a part to play, though, in turning that optimism into reality. So I'm going to end today with a clear call to action for all of us. Firstly, remember, as all of what I've said today should remind us, the virus is still circulating. So continue to be very careful, whatever level your area is in. Please follow the guidance and in particular make sure you're keeping a safe distance from people outside your own family groups. Make sure you're wearing face coverings and remember to wash your hands and surfaces to try to apply all of these basic measures to stop the virus spreading. Secondly, come forward for vaccination when you're asked to do so. We're working to accelerate the programme, especially around second doses, as fast as supplies allow us to do. But we can only vaccinate you if you come forward when you get the invitation. So please do so. Uptake rates have been remarkable so far, but we've got to make sure that the maximum numbers come forward to get vaccinated. That ultimately is our best way forward. And thirdly, please get tested. Everyone now can order what are called lateral flow tests. So go onto the Scottish Government website to find out how. I'll post a link to that on Twitter later. This is particularly important if you're in an outbreak area, and of course in the south side of Glasgow just now, for example, there are locations where you can collect these tests, but it applies to all of us. If we all test ourselves regularly, it means we will identify cases where people have the virus but are not displaying symptoms, and that means we can break these chains of transmission. I know I'm going to be taking a test regularly, and I'm asking everyone else to do so. And remember, if your lateral flow test is positive, you should then book a PCR test to confirm your positive result and follow all of the advice on self-isolation. If we all do this individually, then collectively we're giving this virus much less opportunity to spread. So these are my 3 asks of everyone today. Be ultra careful. Get vaccinated as soon as you're invited and get tested. You know, together we have come a long way, and while these bumps in the road are really difficult for all of us, together we are going to beat this thing. So please stick with it, and thank you very much for bearing with us today. I'm now going to move to questions, at which point you will, I promise, hear from both Humza and Jason as well. And first up today is Gordon Cree from STV.
Thank you, and for what it's worth, I just had my first dose of AstraZeneca's finest this morning, so thank you to Laura, the vaccinator at the Pyramid, for that. On the subject of Glasgow, you've said for at least another week, but realistically, it feels like we're probably looking at longer than that, doesn't it? And on the issue of East Renfrewshire, given that you have case figures going down to neighbourhood level, is there a case for being able to apply restrictions at a more local level than just council areas? Because if someone was living in one of the many parts of Glasgow where cases are negligible, they might feel pretty annoyed that they are suffering for what's happening elsewhere, whereas East Renfrewshire, similarly, there's big differences between different parts of that, yet the whole council area is how the restrictions are applied.
Okay, thanks, Gordon. Jason might want to say a word or two about that latter question. Firstly, congratulations on your first dose of vaccine. It's always good to hear that people have had their first or their second doses. So be like Gordon, make sure you go and get your vaccination as soon as you are invited. These are two really good questions and really fair questions, and I will do my best to try to sort of explain the complexity around this as simply as possible. But I will be quite frank in saying these decisions are really complicated, and we have to try to make sure that we're taking them in as proportionate a way as possible, even if that sometimes looks as if they're not entirely consistent. They are consistent, but it's just that the consistency is based on some quite nuanced information and intelligence about what is happening. Firstly, on the duration for Glasgow, I can't promise, and I think it is not unreasonable to say that next week we may be saying another week. The reason I'm not saying we'll come back in 3 weeks now is that I think I hope the overall duration of these higher level restrictions in Glasgow will be shorter than was the case, earlier this year and at the tail end of last year. So I think it actually makes more sense to review on a weekly basis, because we don't want to keep Glasgow in higher level restrictions any longer than is necessary. Why do I think that? It's because of the scale of the public health interventions that we have in deployment right now. The surge testing, because we are able now, compared to an earlier stage, to use lateral flow devices much more routinely. And of course, we've got vaccination now, and that surge vaccination is really important. And if you live in the south side of Glasgow, and many of my own colleagues and friends are in this category, people who had their first dose just a few weeks ago are already getting the appointments for the second dose. So that's really important. There is also, of course, another factor that I talked about briefly in my opening remarks, is that we are hopeful now that case numbers rising do not, in the way that they were earlier on, before we had vaccination, that they don't translate into the same levels of hospital cases and ICU cases and deaths. And if that bears out, we're just not absolutely sure about that yet, but we're hopeful that that will be the impact of vaccination. And if that bears out, then we may, over the next weeks or months, get to a situation where case numbers are not quite the driver of our decisions that they have been in the past, because we know that even though case numbers are going up, vaccination is stopping people becoming reasonably, seriously unwell. So these are all factors that we are hopeful about and give us confidence that this will be a shorter period than would have been the case a few months ago. And that then allows us to have the weekly rather than 3 weekly reviews. In terms of the more localised restrictions, again, that may be possible at some points, but this is where some of the complexities come in. Firstly, we know that this Indian variant, although the outbreak in Glasgow right now is very heavily concentrated in the south side, when I talk about case numbers of just over 100 per 100,000 for the city, that masks case numbers or case rates in the south side that are much, much higher than that. but we know the variant is present in other parts of the city as well. And in determining where to put travel restrictions, we just have to be mindful of people's travel patterns. You know, people might live in the south side of Glasgow, but in the city, they don't necessarily stay in the south side of Glasgow all the time because they work elsewhere, and vice versa. So sometimes it's the travel patterns that we have to take account of, as well as where the eye of the storm in terms of the infection is. So it's not always as straightforward as we would like it to be, but as I hope you can see today, even taking the risk of what might appear to be apparent inconsistencies, we are trying to be as proportionate as possible, and that will always, particularly in this period ahead, be what we seek with our decisions. So that was quite a lengthy answer, so my apologies. I'll see if Jason wants to briefly add to it.
I think you've covered most of it. I'm delighted you've been vaccinated, Gordon. That's terrific. We've reached that age group, so I hope everybody takes encouragement from that, and everybody should go when asked. And we're bringing forward some vaccination, particularly second doses, to protect individuals, particularly in those areas the First Minister's already outlined. The only thing I would add is, remember, this is two things. The advice the First Minister gets is data plus local public health intelligence. And that local public health intelligence feeds up from very, very local intelligence, streets, areas, up to the Glasgow public health leaders, and then into the government. So they believe there is a difference between these two places. They believe there is a difference between the Glasgow outbreak and the East Renfrewshire outbreak, because they know the streets, they know the people, they know where the positive cases are. Now, the advice is often very similar. Get tested, make sure you do that universal twice a week testing, go if there's testing available, get your vaccine when it's available. But there is a difference in how we give that advice because of the nature of those two outbreaks.
Thanks. David Henderson from the BBC.
Thank you, First Minister. Let me ask, since the pandemic began, you've said the lockdown is in place to save lives and protect the NHS. So in recent days, can you clarify, have we seen any increase in pressure on NHS hospitals, NHS services in Glasgow? And does that still guide your thinking on reopening society? And more broadly, how do you maintain public goodwill towards what are very tough, very widespread restrictions when Glasgow's been in some sort of lockdown on and off since October, and most of these latest infections are in very small hotspots?
I think in terms of your first question, I think I probably answered this in my answer to Gordon Cree, but I'll cover it again. So have we seen an increase in hospital cases in Glasgow? Yes, we have over the last few days, from a very low base to something that is still a low base, but there has been an upward tick in that. Yes, we still have to protect the NHS, but that is not as much of a pressure on current numbers as it has been in the past. But the crucial point here is this, and it's what I said earlier on. We really hope, and actually we're reasonably confident that because of the impact of vaccination, case numbers will not translate in the same way into hospital, ICU and serious illness and death numbers now as they did in the past. But we don't know that yet, because there is a time lag between cases and people falling seriously ill. So until we've got greater confidence around that, we still have to, at least in the back of our minds, if not in the forefront of our minds, leave open the possibility that the rising case numbers in Glasgow now, 3 or 4 weeks from now, will be significant pressure on the NHS. We hope very much that that will not be the case, but we need to give ourselves a bit more time to be confident of that. Now, I remember actually, as we came out of Wave 1 and started to go into the foothills of Wave 2 last year, people said the same thing. Oh, case numbers are not translating into hospital cases. Actually, what we found back then was that quickly changed. So remember the time lags, but we hope this time that vaccination is the crucial difference. There are some question marks right now, and I think there'll be more data published in days to come over the efficacy of the vaccine with the Indian variant. We're very optimistic that overall it will still be effective, but we need to take time to make sure that that is the case. So there are unanswered questions, but we hope it will all develop in the way that we expect. So that's why we just need to be a little bit cautious. You can look at hospital figures right now and think there's not a problem. That might look very different in 3 weeks' time if our assumptions here are wrong, which obviously we hope they're not. And in terms of public goodwill, I understand this. I live in Glasgow, so yeah, I come to work here in Edinburgh, but I'm subject to the same restrictions. Before last Friday, I was really looking forward to having my family in my house, possibly this weekend, in the permitted numbers, of course. I was really looking forward to the prospect of being able to give my mum and dad a hug. I can't do that this weekend because I live in Glasgow and they can't come to me and I can't go to them. And that is the situation for everybody who lives in Glasgow. So if you're asking me, do I understand this? Yes, because I'm part of the population of Glasgow, as is Jason. So this is really, really difficult, and it gets more difficult with every day that passes. The public have been exceptional, and I've said before and I'll say again, I will never be able to convey the gratitude that I feel towards members of the public who've behaved so responsibly. We need to keep doing this until we're out of danger, because if we don't, then all of us will bear the consequences of that in terms of the implications we all know. And I do believe we are closer to the point where these rising case numbers may not be the same concern for the reasons I've said, because the vaccine kicks in and the vaccine stops the implications of this being as severe as it has been in the past. So I think we are much closer to the end of this, not the complete end of the pandemic, that will be a global decision, but the end of these kind of restrictions in Scotland. But there was always going to be bumps in the road, and we've got to just navigate our way over them, round them, through them, whatever, to get to that end point. So I would ask people to stick with it, even though I know how difficult it is. Humza, do you want to say about you obviously represent a constituency that is affected by this as well? So do you want to say just a bit about that?
Yeah, I do, and that's why NHS Greater Glasgow and Clyde have urged those that are in a younger cohort to come forward in parts of the constituency I represent. That's the G51, G52 area, as well as the G41, G42 and the G5 area as well. What I'd also say, just to add to what the First Minister's already said, is hopefully in the next week we will also gather as much intelligence and information from the conversations that we have with other devolved nations, and of course the UK government as well. Jason will correct me if I'm wrong here, but my understanding is that when it comes to the April 2 variant, the emergence of that was a couple of weeks earlier in Bolton and some of the areas that the First Minister outlined in her opening remarks. So we are working closely with other devolved nations and with the rest of the UK to gather as much information about the effects of the April 2 variant, particularly, again, as the First Minister has stressed, whether that critical question, does it lead to greater hospitalisation and greater admissions into ICU. So that additional week buys us also some more time to find out more about this April 2 variant.
Jack Foster from Global.
Good afternoon, First Minister. Over this past week, thousands of people living in the likes of East Renfrewshire and Mid Lothian have been facing serious uncertainty as the infection rates appeared to increase around them, and speculation mounted that they could find themselves in tighter lockdown restrictions, basically with a moment's notice. The consequences on plans made, or of course businesses trying to get back on their feet, are substantial. And yet, despite all of that, there has been no briefing from the government in 10 days. On top of that, when Glasgow discovered that it would be remaining in level 3 this time last week, the announcement came not as part of any statement or an official update, but in response to a question in Parliament. Now, even many of your harshest critics have said that one of the defining aspects of your leadership throughout this pandemic has been communication and a willingness to have the government's decisions scrutinised. Given that these decisions can often be the difference between some businesses staying afloat or going under, or for individuals upending plans and so on, even where the news is not terrible, as for many people in East Renfrewshire today, the anxiety of not knowing can be just as damaging. How confident can people be that they won't have to wait this long for any update, even if that update is simply to say we don't know in the future? So
we've gone from these briefings are too frequent and I'm doing them too often to I'm not doing them often enough. I probably could have predicted that at some point. Look, we've been in an election campaign where I've been restricted over the course of this week. We've had lots of parliamentary process that I've personally, had to go through being elected again as First Minister, doing the official part of this. And we've also been trying to take the decisions and take them as close to the point of decision as possible. If I'd been taking a decision on East Renfrewshire 2 days ago, it might have been a different decision to the one I feel able to take today because I've got more local intelligence. And just to directly respond to the last Friday point, I am accountable to Parliament. So I was preparing to stand here last Friday afternoon, perhaps a bit later because of the cycle of decision making we were in last Friday, and announced the decision around Glasgow and Murray. But then I was required to be in Parliament to answer a question. I don't have the option to say no to Parliament and to come here and do a briefing instead. So I fulfilled my duties to give the answers to Parliament. So that's the way these things work. I will do these briefings as often as necessary to guide the country through this, and we will also take decisions. I can't take away the uncertainty of this. This is an infectious virus that I can't look ahead a week and know with certainty how it's going to be spreading and progressing. I wish I could, but I can't. I've said many times before that I don't have a crystal ball. What I try to do is take decisions at the optimal moment. And by optimal, I don't mean that makes it easier for anybody, but not to take them prematurely so that we're being harder than we need to be, and not leave them too late so that we are, allowing things to develop in a way that we don't. So trying to take these decisions as close to the point where we can be as certain as we can is not perfect. And we don't always get this right, but we're trying to do that as best we possibly can, and will continue to do so. Alan Smith from Bauer.
Thank you, First Minister. I was just wondering about the subticking cases that we're seeing just now and the impact that might have on your overall rollout of restrictions. Level 0's earmarked for the end of June. Is that still, do you think we're still on track to get to level 0 by the end of June? And when you've got areas like Glasgow remaining in level 3 for a little bit longer, could we be in a position where parts of Scotland move to level 0 and other parts of Scotland like Glasgow are just that further bit behind? And just secondly as well, do we have any updated confirmed numbers for the April 02 cases in Scotland?
I'll hand over to Jason on the April 02. On the first point, the reason we have stuck to the level system is, while I would rather the whole country was moving at the same pace out of restrictions, we've retained the level system to give us more flexibility, so that when we have the situation that we have in Glasgow right now that needs tougher restrictions, somewhere like the Borders or parts of the Highlands that have very, very low cases don't also have to be in these tougher restrictions. We can be more proportionate and more flexible, and I think that's the right way to be. And that does mean it is possible that in future you'll have parts of the country in level 0 and parts of the country in higher levels. I hope that doesn't happen. I want us to continue to move on the basis that we're on track to move through the exit from lockdown in the way we set out. I can't say that with absolute certainty, and I think it's obvious from the situation we're dealing with. But if we all do the right things, if we continue to make sure as government that these public health interventions are being properly deployed, then yes, I think we should continue to be optimistic that we can move more or less together through those levels, get to level 0, and then, as I say, look beyond level 0 to what is a much greater degree of normality over the summer. But, I really do understand, because I feel it myself, that the longer we go through this, the less patience all of us have with the nuances and the complexities and the uncertainties of all of this. I really do understand that. But the uncertainties and the nuances and the complexities are still the same as they were right back at the start of this. And it does make it difficult to be absolutely certain about all of this, which is why it is also important that we take things step by step, be precautionary when we need to be prepared to, go and be proportionate as we are being today, and get ourselves through this step by step. Vaccination is still the big thing that offers us the hope, which is why I do retain that confidence that the summer of greater normality that we talked about a couple of months ago is still something that we can be optimistic about. Jason.
I'm equally hopeful, briefly. Let's remember that we're spending all of our time talking about the areas that we're finding challenging, but the majority of the country moved as we predicted. Numbers have gone up a little because we've allowed people to mix. That's exactly what we predicted would happen. And now we're being cautious, principally because of the new variant, but also because we see slightly more increase than we had anticipated. But it's important to keep that in perspective. The rest of the country is moving as we thought it would. The UK government and Public Health England every Thursday publish the genetic numbers of variants of concern. So they did that yesterday, and Scotland's number, I don't actually have it, so I'm going to say that we'll give it to you later, but it moved from 35 genetically confirmed cases to around 130. I think from memory it's 134, but we'll check and get you that number, or you can Google variants of concern UK data, and you'll find all of the data there. It's important, though, that's just the genetically confirmed ones. We believe there are more than that across the whole of Scotland and the whole of the United Kingdom, because we have proxy ways of measuring that, and genetics takes a little bit longer.
Nicole Cassells from Central FM.
Thanks, First Minister. So there's been confusion recently around countries on the amber travel list about whether people can or can't go to them. So why is the government not just saying you can't go to these countries instead of saying you can go, but actually you shouldn't go?
Well, we're putting in place a risk-based system. We have put in place a risk-based system because some people have to travel for essential purposes, and we need to make sure the rules are clear based on a risk stratification. That's the green, amber and red. But anybody who has listened to me over the course of the past few months will have heard a very clear message. If you do not need to travel, don't travel internationally, is my advice right now. That's tough advice. It's really tough for the aviation sector. I know that, and often get, understandably, a lot of criticism and pushback there. But that has been my consistent advice. We need to have rules in place for those who feel they have to travel, but right now you should not, in my opinion, be travelling abroad on holiday. People get upset, and I understand this when we talk about international travel as if it's all about holidays. For a lot of people, international travel is about seeing their family that they've been separated from for a long time now, and many people will think that that is essential travel. But if your travel is not essential, stay in Scotland. As we see, this virus is mutating, new variants are developing, and the safest thing to do, if you can possibly manage it, is to stay in Scotland until we are much further through this and in a safer position. Tom Eden from PA.
Thank you, First Minister. Good afternoon. Pupils and teachers are still in the dark about the SQA's appeal process for this year's assessments. Time's quickly slipping away until grades have to be submitted by teachers, and no one knows what evidence needs to be gathered specifically to challenge any awards or changes of grades. Fiona Robertson there, the SQA's chief executive, said to MSPs in March the details will be published late April, early May at the latest. That's obviously untrue. John Swinney said last week it would be published shortly, but the SQA told me this morning that it had still not been finalised. Is that acceptable? And when do you think you'll be able to publish details? And does this mean, or does it look like we're on course for another exams fiasco?
No, I don't think we are, but we're taking great care over these decisions. So it's important that we try to get the system for appeals right, and we've been listening carefully to some of the representations that have been made from including the Children's Commission. I personally had discussions with education officials about this week to make sure we get the details of that right. The details of it are being finalised, and we do expect to publish the details of what the appeals process looks like very soon. And I hope that it will give a lot of reassurance to young people that if they feel when they get to the grade that is awarded to them that they are not happy with that, then they have the ability to go through an appeals process. But I hope people will understand, given the situation we're in right now, that we're taking time, and the SQA is taking time to get that as right as possible. But obviously the model that has been agreed with the input of teachers and with the EIS in particular for the certification of results this year, the alternative certification model. Again, a lot of time has been taken over that. I know it's an anxious time for young people and indeed an anxious time for teachers, but it's important that we do these things as well as we possibly can for the interests of young people, and that applies to the appeals process as well. Rachel Watson from the Mail.
Thank you, First Minister. I just want to follow up on Alan's question about the move forward through the easing of lockdown restrictions. Are we still currently on track to meet the early June date for move into level 1 for most of the country? And just back to Glasgow, we have seen a slight rise in hospitalisations in Glasgow, and I wonder if there's any information you can give us in relation to the vaccination status of these people who are in hospital. Have they had any dose, 1 dose, 2 dose of the vaccine?
I'll hand over to Jason on that. I mean, as I said in response to a question earlier on, we have seen a slight increase in hospitalisation in Glasgow, but it is still at very low levels. So, you know, for reasons of patient confidentiality, we will be very restrictive in anything we say about the nature of that. But Jason might want to give a word or two more detail. I don't think I've got much to add to my answer to Alan on the first part of your question. I hope that we can meet all of the milestones that we've set, at least for most of the country, even if we have hotspots that might make that different. But I'm not going to prematurely make these decisions, because actually that is not the best way of trying to do it. We will set out what we think about the June milestone much closer to that, so that we can take account of all of the up-to-date data. But I hope, and I am optimistic, that not least with the benefit of vaccination, we will still be able to move through the milestones that we set earlier in the year.
So 4 weeks ago, there were 93 people in hospital. 2 weeks ago, there were 68. And on the 21st of May, there were 81. So it was up, down, up again. And we simply can't ignore that. About half of those 81 are in Glasgow hospitals. And there were 5 admissions in the 24 hours up to yesterday, the last time I spoke to the Public Health Director yesterday afternoon. There are some vaccinated people in hospital, but I'm not going to tell you exactly where they are, exactly which doses they've had and what age they are, because that would be inappropriate. What I can tell you, though, remember, the vaccination doesn't take away the disease for everybody. What the vaccination does is it reduces the disease severity in almost everybody. So if you imagine the disease is a line from asymptomatic, no symptoms at all, up to, unfortunately, death, what the vaccination does is it moves everybody down that line. So if you might have died, you might now be ill, but you won't die. That's why it's so important to get it. If you were going to be in hospital, you may now not need hospital, because the vaccine will protect you. Now, for a lot of people, it protects you entirely. You may not even catch the virus, but you might catch it, not know, and still transmit it. That's why everybody needs the vaccine. So yes, around the world, there are people hospitalised who have been vaccinated, but it's the wrong metric, because we don't know what would have happened to them if they hadn't had the vaccine.
Graham Mann from The Sun.
Hi. Can you be clear about what you think has caused the spread in the south side and in which communities? Because there's been a suggestion that Ramadan and Eid could have exacerbated the situation, and we obviously don't. We need to be careful not to stigmatise communities. Is it right that the whole of Glasgow should be kept under restrictions if only certain parts of the city are affected? And just finally, do ongoing concerns about the south side and the wider Glasgow area pose a threat to our ability to host the Euros at Hampden Park in just over 3 weeks' time?
Firstly, no, I don't expect there is a threat to our ability to host the Euros. Obviously, we keep all aspects of this under review, but we're all looking forward to seeing Scotland play at Hampden and seeing the other matches at Hampden, and we should continue to look forward and be positive about that. I really think it's important that we don't start to point fingers of blame around this virus. It's a virus. Nobody is exempt from the risk of getting it or passing it on. The communities in the south side of Glasgow, which clearly I know very well because it is my constituency, have worked as hard as everybody else has over the past year to try to stop the transmission of the virus. In different communities, urban, rural, there are different factors at play in terms of population density, housing conditions that all play a part in this. We know that our ethnic minority communities have been, to some extent, disproportionately affected by this virus, both in terms of propensity to get it and become ill or die from it. There were level 3 restrictions in place during Eid. Humza and I, with Anna Sarwar, visited Glasgow Central Mosque the day before Eid and spoke to people there. And I know from my own constituents that just as many of us had restrictions on our Christmas celebrations, this is the second Eid where Muslims have had restrictions on their ability to mark Eid, and they have borne those sacrifices in the way that others have. So this is a virus that we all collectively have to make sure we play our part in reducing the spread of. But Humza, do you want to maybe say a bit more about the question?
Yeah, I can say maybe a little bit about both questions in terms of Euros, reiterating what the First Minister has said, but clearly the action we're taking now is that we hope that, of course, when the time the Euros come in early to mid-June, that we're in a much better place, of course, and we suspect that we allow those spectators to get into the stadium to watch Scotland play, and hopefully Scotland win as well. I took part in Ramadan. I fasted during Ramadan and had another Eid where I didn't get to see my family. And that was a sacrifice that, of course, I was very happy to make, understanding the public health imperative. But I know certainly from my conversations with friends, family members, but also because I've grown up in that community, particularly in the community in Pollock Shields and around the south side of Glasgow, that many people made that very same sacrifice. And I have to say I was hugely impressed that when I did visit Glasgow Central Mosque, and I have visited other mosques as well when restrictions have allowed, that they have got really stringent measures in place, an excellent one-way system. They've got hand sanitising systems in place. Everybody has to bring their own prayer mat, for example. And they're really, really strict about the measures very much put in place. So all I would say is that, reiterate what the First Minister has said, there is also a reason why we are calling it the April 02 variant. I think it is so important for us not to allow this virus to divide us as communities and people. And I think I would just like to reiterate that message as much as I possibly could.
Indeed. Thank you. Tom Martin from the Express.
Hi, thank you, First Minister. Could I just return to the question of public goodwill and the situation in East Renfrewshire? In your opening statement, you asked people to perhaps delay visiting people in other parts of the country. How seriously do you think the people in East Renfrewshire should sort of take this reprieve and this opportunity to help get things back under control? And is there any other sort of things you could recommend they do to get the situation back under control? And secondly, just for the National Clinical Director, you were talking about sort of data around variants of concern. What does the modelling show about this April, what you're now calling the April variant becoming the most dominant in Scotland? Is there any sort of data on that? Thank you.
I'll let Jason answer that, but we do think it is becoming more prevalent in our overall picture. My advice to people in East Renfrewshire, and actually it perhaps applies particularly in East Renfrewshire given the case numbers there, but it applies actually to everybody. We just all need to be really careful, continue to be ultra careful. The virus, while it's in many parts of Scotland, it's at very low levels, it's there. And I remember saying this round about the kind of start of the autumn last year, as it was, starting to show signs of gathering pace again. Everywhere we are right now, we should assume that the virus is right there with us, that it's in the room with us, or that it's in a gathering that we might be in, even if it's within permitted numbers. And just be very conscious of the things that might stop it jumping from you to somebody else or somebody else to you. And that is just the basic stuff that we've all had to remember all year. It's about keeping a distance, just keep a safe distance. I know we all get hung up, what's a metre, what's 2 metres? Just keep a safe distance, preferably 2 metres, but don't get too close to people that are not in your family group. Wash your hands if you're going in or leaving your house. Wash your hands, wash the surfaces, wear your face covering. Be vigilant and think of it, that whoever it is you might be speaking to, they might have the virus, or you might have it and one of you might pass it to the other. And that sounds really basic, but when we strip it all back, it is really basic in terms of what you can do to stop a virus spreading. And that applies more indoors. So level 2 obviously allows more indoor interaction than level 3. But just because it allows it doesn't mean you have to go indoors. If you can stay outdoors, stay outdoors. If the weather is reasonable, if you've got family round, particularly in East Renfrewshire right now, stay in your garden rather than going inside. If you're going for a coffee or a beer somewhere, if you can, sit outside rather than go indoors. It's just all this really tedious. I know it's always driving us all mad, but really tedious, but really important stuff that we just need to try to do to stop it spreading. And if every one of us remembers that, then all of these individual actions will add up to a big collective effort.
There are 16,000 versions of this virus in circulation around the world, and the virologists describe virus fitness. And every so often, one becomes fitter than the others and wins. Now, fitness does not imply worse disease or vaccine escape. They're different things. But the one that wins the race is the fittest. That might be because it attaches to your cells better. It might be because it's more transmissible, but it may not be. So this one appears to be fitter. And therefore it is winning the race in the north of England, and it's increasingly winning the race in some of our communities. So we think it will almost certainly become the dominant variant. That's not necessarily something to worry us. What we need to know is the answers to the questions the First Minister outlined at the beginning that I simply cannot tell her yet. So is it more transmissible? Does it cause the same disease, worse disease, or perhaps less disease? And what's the relationship with vaccines? So far, it looks very similar on all three of them, but there are large confidence intervals around those data, so I cannot be certain. And that's why the advice is so difficult to give, and the choices are very difficult to make.
Thanks. Dan Sanderson from The Telegraph.
Thanks very much, First Minister. Just on Glasgow, if the case numbers continue to rise, potentially if we start to see the impact of the Rangers fans' actions and the other protests we've seen recently, is it possible that it could move back up to level 4 to get this under control? And also, you published a strategic framework update with, I think, based on World Health Organization recommendations, which suggested 50 cases per 100,000 was sort of the threshold for moving into level 2. Can we basically disregard that now, given clearly East Ren is more than double that and is still able to stay in level 2? Or is that still part of your thing? Thanks.
No, you can't disregard it, Dan, and can I gently suggest you maybe go and read it again and read it closely? The 50 cases per 100,000 is one of the measures we use, but it's not the only one. We use a basket of measures, and we've always said very clearly that it involves judgment as well, and it involves the very local public health intelligence that Jason talked about earlier on that feeds through into these decisions. This would be so much easier for everybody, including me, if it was just a kind of magic, metric that you just looked at, and as soon as it got to that, you flicked a switch. It's not. And if I was to try and base my decisions on that kind of formulaic way of doing it, I would sell people short, because we would end up with people in higher restrictions than necessary, or we would end up, not taking measures that were necessary, and then allowing the situation to run out of control. So I know it's harder for me as the decision maker. It's harder for people to understand. I know that, but we've got to be as nuanced and as sophisticated in these decisions as possible, because that's what makes them most effective while being most proportionate. And on, could Glasgow go to level 4? It just doesn't help anybody to speculate. If we keep doing all the things we're doing, then the situation should start to improve, and we can start to get Glasgow back down. But in theory, right now, of course, I can't foresee the future. I can't rule out that in Glasgow or some other part of the country there's not going to be a really serious outbreak that might make a higher level of restrictions necessary for a short period of time. But everything we are doing is intended to avoid that. And everything we know about the impact of vaccination gives us confidence that we will be able to avoid that. But we can't be 100% certain about everything. And again, it would be much easier if I could be, but I can't. And that's why it's really important to try to take people, even now when we're all tired of it, 14 months on, continue to take people as logically through the decision-making process as I possibly can. Helen McArdle from The Herald. Oh, sorry, I've been told Helen is not with us. So the last question today in that case is Elsa Maishman from The Scotsman.
Thanks, Professor. As well as Glasgow and East Renfrewshire, are there any other areas you're concerned about with regards to cases and a possible move to level 3 perhaps? Midlothian, for example, are you concerned about, or Clonmacnoise? And secondly, just on the ruling released today from the Scottish Information Commissioner about National Records of Scotland releasing information on care home deaths during the pandemic, are you able to respond to that? And do you think the release of that information is important for transparency around the COVID-19 pandemic?
I'll respond to that in a second. I mean, obviously we publish data now for different areas, so I'm not going to start naming areas, but any area that's got an increasing level of infection is a worry for us, and we look at it very closely. And we look at all of these areas. We have a watch list of areas that have rising case numbers. As I say, that is not some great secret, because anybody can go onto the Public Health Scotland website and look at the case numbers in their own, very, very localised communities. So people can work out the areas that we'll be watching carefully. But we think at the moment that apart from Glasgow, other parts of the country can safely stay in level 2. In fact, our islands, or many of our islands, are in level 1. But we know that situations can develop quickly. So this literally is a daily monitoring exercise, as indeed it has always been, and it will continue to be. On the issue of the NRS statistics around care homes, I'd say, I think, a couple of things. Firstly, some of the reporting around this has suggested that the decision of NRS not to publish the breakdown of care home deaths by care home somehow masked the scale of care home deaths. And I want to be very, very clear that that is not the case. The total number of people who sadly lost their lives to COVID, who were residents in care homes, it has been reported. So there is no masking of the scale of that. This was an issue about the publication of data that allowed that overall number to be broken down to individual care homes. That wouldn't have changed the overall number. National Records of Scotland is an executive agency of the Scottish Government, which means that it operates in these kind of decisions independently of ministers. They have to make assessments of freedom of information requests and respond appropriately, or as they consider to be appropriate, but they also have to respond to decisions of the Freedom of Information Commissioner, and I would expect that National Records of Scotland will do that. There is absolutely no intention. The last point I would make, of course, is some of this information has already been released through, I think, release of information and data from the Crown Office a matter of weeks ago. I would simply, say very clearly, and I hope people have heard this from me before, there is an absolute determination on the part of me, everybody in the government, and I think all of us, to learn every possible lesson from what we've been through in the past 14 months so that we can have proper scrutiny and accountability, but more fundamentally so that we can learn the right lessons. That's why I want to see a public inquiry get up and running as quickly as possible, but it's also why we will continue to learn the lessons as we go from the data, and that includes in care homes, and many of those lessons that have been painfully learned over the past year have led to a material change in the situation in care homes in the second wave of this virus to that pertained in the first. So that transparency and scrutiny is really important for all sorts of different reasons. That concludes the questions today, so my thanks to all the journalists for them, my thanks to Rachel for her BSL interpretation, and thanks to Humza and to Jason for joining me today. We will regularly update from this podium over the course of the next few weeks, and we'll notify the days on which these briefings are taking place. If there is a need to do them more frequently, we will absolutely do that. For now, though, can I just remind you of that 3-point call to action from earlier on, particularly important in the outbreak areas of the south side of Glasgow, the whole of Glasgow City, East Renfrewshire, and also important, though, in every part of the country if we are to collectively continue, notwithstanding the bumps in the road, to get ourselves through this. So remember to be careful. Act as if the virus is there around you and take the steps that we know work in stopping its spread. Secondly, please come forward for your vaccination as soon as you are invited to do so. uptake rates have been high, but not everybody has come forward to attend their appointments. Health boards will be working to try to get people who have maybe missed their appointments to come forward in future. But if we all come forward at the first time of asking, we'll get that vaccination protection spread as quickly as possible. And thirdly, get tested. You can order the lateral flow devices to test yourself up to twice a week. I would encourage you to do that, and as I say, we'll tweet a link later on. And then if you test positive in a lateral flow device, the advice is to book a PCR test so that that can be confirmed, but that you can then start to follow all of the advice around self-isolation. All of these steps help break the chains of transmission. And today, just as much as was the case right at the outset, it's all of our individual actions that will add up to the collective effort. And I absolutely still believe get us through this and into a position of much greater normality as we get through the summer. So please, I know how difficult it is when we have these setbacks, but stick with it. Together, we've come a long way, and together we are going to get through it. So thank you very much indeed, and I will see you from here next week.